Image source, Pexels. Are you tired of living with the debilitating pain and stiffness caused by rheumatoid arthritis? Looking for a game changer in your treatment regimen? Look no further than Adalimumab. This revolutionary medication has taken the world of rheumatoid arthritis treatment by storm, providing millions of patients with newfound hope and relief. Adalimumab, also known as Humira, is a biologic drug that targets and neutralizes a specific protein in the body, known as tumor necrosis factor, TNF, which plays a key role in inflammation. By blocking TNF, Adalimumab helps to reduce joint pain and swelling, improve physical function, and slow down the progression of rheumatoid arthritis. But that's not all. This wonder drug has also shown promising results in treating other autoimmune conditions such as psoriasis, Crohn's disease, and ulcerative colitis. So if you're ready to regain control of your life and bid farewell to the limitations imposed by rheumatoid arthritis, it's time to consider Adalimumab as your ultimate game changer in treatment. Traditional treatment options for rheumatoid arthritis. For many years, the treatment options for rheumatoid arthritis were limited and focused on managing symptoms rather than targeting the underlying cause of the disease. Non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen and naproxen were commonly prescribed to reduce pain and inflammation. While these medications provided temporary relief, they did not slow down the progression of the disease or prevent joint damage. Disease-modifying antirheumatic drugs, DMARDs, such as methotrexate were introduced to address the underlying immune system dysfunction in rheumatoid arthritis. However, these drugs often came with significant side effects and were not effective for all patients. The need for a game changer in rheumatoid arthritis treatment. The limitations of traditional treatment options highlighted the need for a game changer in rheumatoid arthritis treatment. Patients were desperate for a medication that could not only alleviate their symptoms but also slow down the progression of the disease and improve their overall quality of life. This is where Adalimumab stepped in to change the game. What is Adalimumab? Adalimumab, marketed under the brand name Humira, is a biologic drug that belongs to a class of medications called TNF inhibitors. It is a genetically engineered antibody that specifically targets and neutralizes tumor necrosis factor, TNF, a protein involved in inflammation. By blocking TNF, Adalimumab helps to reduce the signs and symptoms of rheumatoid arthritis, including joint pain, swelling, and stiffness. It also helps to prevent joint damage and improve physical function, allowing patients to regain control of their lives. Adalimumab is administered via subcutaneous injections, usually once every 1 to 2 weeks. The medication is available in pre-filled syringes or pens, making self-administration convenient for patients. The dosage and frequency of Adalimumab may vary depending on the individual patient's condition and response to treatment. How Adalimumab works in treating rheumatoid arthritis. Rheumatoid arthritis is an autoimmune disease where the body's immune system mistakenly attacks the joints, leading to inflammation, pain, and joint damage. TNF is a key player in this inflammatory process. Adalimumab works by binding to TNF and preventing it from activating the immune cells responsible for inflammation. This helps to reduce joint inflammation and slow down the progression of the disease. The effectiveness of Adalimumab in treating rheumatoid arthritis has been extensively studied and proven in clinical trials. Research has shown that Adalimumab not only provides rapid relief from symptoms but also improves physical function and quality of life. It has been shown to significantly reduce joint pain and swelling, increase mobility, and improve overall well-being in patients with rheumatoid arthritis. Furthermore, long-term studies have demonstrated that Adalimumab can help prevent joint damage and deformities, leading to better long-term outcomes for patients. Benefits and effectiveness of Adalimumab. The benefits of Adalimumab in treating rheumatoid arthritis extend beyond symptom relief. This game-changing medication has shown remarkable efficacy in improving physical function, reducing joint damage, and enhancing overall quality of life for patients. Studies have consistently demonstrated that Adalimumab significantly reduces the signs and symptoms of rheumatoid arthritis, including joint pain, swelling, and stiffness. Additionally, it has been shown to improve physical function, allowing patients to perform daily activities with greater ease and independence. Adalimumab has also been proven to slow down the progression of the disease. By targeting and neutralizing TNF, it helps to prevent joint damage and deformities, preserving joint function and mobility. This is particularly crucial in rheumatoid arthritis, where early and aggressive treatment is essential to prevent irreversible joint damage. Furthermore, Adalimumab has shown promising results in treating other autoimmune conditions. It has been approved for the treatment of psoriasis, a chronic skin condition characterized by red, scaly patches. Adalimumab helps to reduce the inflammation and improve the skin symptoms associated with psoriasis. It has also been effective in managing other inflammatory conditions such as Crohn's disease, an inflammatory bowel disease, and ulcerative colitis, a chronic inflammatory condition affecting the colon and rectum. The versatility of adalimumab in treating various autoimmune conditions further solidifies its status as a game-changer in the field of rheumatoid arthritis treatment. Potential side effects and risks of adalimumab. Like any medication, adalimumab does come with potential side effects and risks. The most common side effects include injection site reactions, such as pain, redness, and swelling. These reactions are usually mild and resolve on their own. Some patients may also experience flu-like symptoms, such as fever, chills, and fatigue, after starting adalimumab. These symptoms are generally temporary and tend to improve with continued use of the medication. There is a small risk of serious infections with adalimumab, as it suppresses the immune system to some extent. Patients should be monitored closely for signs of infection, and any infections should be promptly treated. Rarely, serious and potentially life-threatening infections may occur. It is important for patients to discuss their medical history and any existing infections with their healthcare provider before starting adalimumab. Adalimumab may also increase the risk of certain types of cancer, although this risk appears to be low. Regular monitoring and screening for cancer are recommended for patients on long-term adalimumab therapy. Adalimumab dosage and administration. The dosage and administration of adalimumab may vary depending on the individual patient's condition and response to treatment. It is usually administered via subcutaneous injections, either in the abdomen or thigh, once every 1 to 2 weeks. The medication is available in pre-filled syringes or pens, making self-administration convenient for patients. However, some patients may require assistance from a healthcare provider or caregiver for administration. It is important for patients to follow their healthcare provider's instructions regarding the dosage and frequency of adalimumab. Missing doses or discontinuing the medication without medical advice may reduce its effectiveness and increase the risk of disease flare-ups. Patient experiences and success stories with adalimumab. The impact of adalimumab on the lives of rheumatoid arthritis patients cannot be understated. Countless individuals have shared their success stories and experiences with this game-changing medication. Patients who were once confined to wheelchairs or struggled to perform simple tasks have reported significant improvements in their symptoms and quality of life after starting adalimumab. Many have regained their mobility, returned to work, and resumed their favorite activities, all thanks to this revolutionary treatment. The positive impact of adalimumab extends beyond physical improvements. Patients have reported improvements in their mental and emotional well-being, as the reduction in pain and disability allows them to engage more fully in life. They no longer have to constantly worry about the limitations imposed by rheumatoid arthritis and can focus on pursuing their passions and enjoying meaningful relationships. Comparing adalimumab with other rheumatoid arthritis treatments. Adalimumab is not the only medication available for the treatment of rheumatoid arthritis. There are several other biologic drugs that target TNF, such as etanercept and infliximab. These medications work in a similar manner to adalimumab and have shown comparable efficacy in clinical trials. The choice of medication may depend on factors such as patient preference, cost, and specific medical considerations. In addition to TNF inhibitors, there are other classes of biologic drugs that target different pathways involved in rheumatoid arthritis. These include medications such as rituximab, abatacept, and tofacitinib. These drugs may be considered when TNF inhibitors are not effective or well tolerated. Non-biologic DMARDs such as methotrexate continue to play a crucial role in the treatment of rheumatoid arthritis. These medications are often used in combination with biologic drugs to optimize treatment outcomes. Methotrexate is a commonly prescribed DMARD that helps to suppress the overactive immune system in rheumatoid arthritis and reduce inflammation. The choice of treatment should be individualized based on the patient's specific needs, disease severity, and response to previous therapies. It is important for patients to work closely with their healthcare provider to determine the most appropriate treatment regimen. Conclusion: the impact of adalimumab in improving the lives of rheumatoid arthritis patients. Adalimumab has undoubtedly revolutionized the treatment of rheumatoid arthritis. This game-changing medication has provided millions of patients with newfound hope and relief from the debilitating symptoms of the disease. By targeting and neutralizing TNF, adalimumab helps to reduce joint pain and swelling, improve physical function, and slow down the progression of rheumatoid arthritis. It has also shown promising results in treating other autoimmune conditions such as psoriasis, Crohn's disease, and ulcerative colitis. While adalimumab is not without potential side effects and risks, the benefits far outweigh the risks for many patients. The positive impact it has on their lives, both physically and emotionally, cannot be overstated. Countless success stories and patient experiences attest to the life-changing effects of this game-changing medication. If you're tired of living with the limitations imposed by rheumatoid arthritis, it may be time to consider adalimumab as your ultimate game-changer in treatment. Consult with your healthcare provider to determine if adalimumab is the right choice for you and take the first step towards regaining control of your life. With adalimumab, relief and a brighter future may be just around the corner. Thanks for watching.